So it is now National Nutrition Month, and while we all understand the need for a healthy, balanced diet, it's more difficult for some to get that than others. In our state, more than 380,000 people don't know where their next meal may come from, and more than 83,000 of them are children. And hunger for a child impacts much more than just their stomach. Research shows that the levels of prenatal iron are linked to challenges with language comprehension during the first 5 years of a child's life. Childhood hunger is also a predictor of depression in adolescence and young adulthood.
Even in particular breakfast, if children don't have access to good breakfast, academically they suffer because they don't have the energy to get through the school day. So timing of meals, in addition to what they have access to, can have an impact for kids.
That is Sherry Gray. She's an educator in UConn's Department of Extension. As you heard her say, it's not just about getting all the meals, but having access to the right types of foods.
If you live in an area of the state where you really don't have access to a great grocery store and you're really just shopping around the corner, options become more limited. However, tapping into resources like the mobile food pantries that Connecticut Food Share offers can bring produce to you more locally, as well as dairy. And so those options would be available. Also knowing what to choose in a food pantry that might be more shelf-stable, nutrient-dense items versus just processed foods.
And processed foods are everywhere, and they tend to be snack foods, prepared foods with lots of starch and lots of sodium. They usually require less cooking, and they last longer than fresh vegetables, but that comes at a health price.
They typically have been processed with added fats, added sugars, added sodium, which can all lead to chronic diseases like hypertension, cardiovascular disease, diabetes. So it's not to say you can't have those items in your diet, but if you're using those as your predominant base of your diet, you're missing out on nutrient-dense foods.
Now, Gray encourages you to reach out for things like peanut butter, tuna, yogurt, nuts and seeds, even low sugar cereals. They're relatively long-lasting foods that are nutrient dense. Gray says food insecurity continues to be an important topic too, especially since the need continues to grow.
And now what we're seeing is SNAP income has dropped in terms of eligibility. There's no more relief checks. So we're actually seeing more food insecurity than we've seen in the past. And so to address these needs, I think trying to have these safety programs, the safety nets available for people where they know to go for resources, and then reaching out to at-risk communities to help with food budgeting, stretching their food dollars.
Now, grab your phone and you can dial 211. That is a great resource. She says she also encourages people to reach out to UConn about free nutrition education classes. And if you're fortunate enough not to struggle with food insecurity and you would like to help, consider donating to a food pantry or even volunteering your time at one.